The disruptions and the problems created by the pandemic COVID-19 have very badly affected all spheres of human life. The entire humanity suffered a lot. But I hold the view that it is the medical professionals who have gone through the most tiring and taxing experiences during this period. Today, I'm quite lucky to get a chance to spend a few minutes in the company of a very busy and famous neurosurgeon, Dr. Sajesh Menon, who is the head of the Department of Neurosurgery, Amrita Institute of Medical Sciences, Kochi.
Hello.
Sir, I know for a surgeon like you, every minute is precious. Still, I would like to ask you a few questions about your professional and personal life. I know neurosurgery is your specialization, so is it a challenging field for you?
Of course, neurosurgery is a challenging specialty. There are I tell you the reason. Because here the patient is coming with hematoma or head injury. The time factor is very critical. So he is bleeding inside his brain. All the brain structures are getting compressed. And the circulation to the brain is compromised every minute and minute. If you delay 1 minute, the patient can become a brain dead within that minute. So you have to push the patient immediately, especially the cases like extradural hematoma and all. You push the patient inside the OT, and the OT might not be ready by that time, but you don't wait for that. You start positioning the patient, giving anesthesia and start surgery, and the nursing staff and other supporting staff will arrange things around you while you are operating. That is one aspect. Second aspect, the brain is tumors. The brain tumors are usually arising from critical areas. So you have to operate, you have to make a corridor, surgical corridor between this vital structure. So you have to know these vital structures exactly where it is, and you have to avoid those structures and go besides or around it, and you have to operate. We are operating through the microscope. It is called operating microscope. We will get an enlarged view, 10 times, 15 times, 20 times enlarged view you are getting. So with that, you are slowly removing the tumor. So even by a microscope view, if you see that the tumor is big, 1 centimeter size, but actually it is 1 millimeter size. So you have to remove it slowly. So it can take time, like 12 hours, 18 hours, 24, even 24 hours. So you cannot take a break in between, long break I mean. We'll go take a small break, like to take a tea or a coffee, and then come back and operate till the patient is, the tumor is out. We cannot sit, we cannot relax, or we cannot take a rest or anything. So the end point of the surgery is the complete removal of the tumor, whatever, how many hours it takes doesn't matter. So in that way also it is a challenging field.
Does the COVID-19 lead to any serious neuro problems?
Frankly speaking, COVID itself is not affect brain actually. But the problem is, during the initial period of the COVID, I told you, road traffic accident, anything can happen to the patient. And as I said, the time factor, it is very critical in neurosurgery. So we cannot wait for the COVID report or anything. We have to take the patient to the COVID OT. Initially, there was no COVID OT also available. Because initial days, I am talking about the COVID-19 initial days. I remember a situation where we had to do to operate a patient. We were RTA with a bleeding inside the brain, and we were operating. Everybody was wearing only the normal attire, like the standard theater dress and all. And then the middle of the surgery, we got a telephone call from the microbiology lab, and they say that patient is COVID positive. You have to remember that it's an initial period, not like now. Now everybody know how to do, and this time everybody was frozen in the theater, because we are dealing with a COVID patient, probably the first time in my life or in their life also. So we don't know what to do. For a second, as I said, we froze, and then everybody was looking at me because I was the leading surgeon. I had to take a decision regarding this. I can clearly see that each of the assistants, like a staff, nurse or a technician, anesthesia technician, anesthetist and all, everybody is thinking about the COVID, that fear, their eyes I could see at that time. But we were in the middle of the surgery, with no way we cannot abandon anything. Then I said, okay, let us continue with the surgery, don't waste time, we'll think about this later. Because that confusion lasted only for a moment, I would say. The next moment we were back to surgery, the same seriousness and the same thing. We completed the surgery, patient is shifted back to the ICU isolation. And then only even the staff, they are all tuned. During surgery, they won't think about anything. They just think about the patient and whatever it need to be done for the patient. But later, they all think about their family members. They can get affected. You can get affected. They can spread all. Then we all went for a quarantine for 7 days. Luckily for us, nobody was got infected or anything. This at that time the PPE kit was not also available. Later there was a dedicated theatre was established for the COVID patient, and then the PPT kit is also available. PPE kit was also available. We were operating with a COVID protocol. This I am telling you, this has happened before that period. That is all about the COVID. Then again, the COVID directly will not affect the brain. As you all know, that is mainly affect the lungs, and the lung is the main target. And then sometimes you can get bleeding. Some patient can get bleeding in the brain also. That is how COVID affect the brain actually. Such bleeding cases were stroke, you can call it a stroke. Stroke were on the rise during the peak COVID time. Then again there is another infection like fungal infection. You all know that mucormycosis was very rampant. That actually it is starting from in the nose, but there is a connection, there is a thin layer of bone is between the nose and the brain. So it can invade through that bone and can get into the brain. Luckily, we didn't have much cases, only few cases. Those cases we could manage with the medicines alone, and no surgery was done for such cases.
So right now, the road accidents are on the rise now because everybody has to use their own vehicles to commute. So almost all the serious accident cases reach you. And how do you manage your hectic schedule?
Regarding the road traffic accidents, initially the cases were less because there was a lockdown, and the people were inside the house, and in between there was a relaxation in the lockdown. At that time, everybody, as you correctly said, patients use their own vehicles, and the public transport system was not available, or people are afraid to get into a public transport system. So the accidents will become again on the rise, and we got so many patients. Then, as I said earlier, we had to operate throughout the night. By shift wise also we have to operate. Patients are coming with accident, with various injuries, mostly the orthopedic injuries, but few patients got a brain injury as well. So we had to team with the orthopedic surgeons and general surgeons also, even cardiac surgeons for the chest injury part. And there is a team dedicated for this in our hospital, so to deal with such cases. And now again the restrictions have started coming. Now the cases are coming a little less nowadays.
And your professional field is being so challenging and stressful. And for that, how do you manage or de-stress or relax for yourself?
This is actually a very good question, because see, the stress if you keep on doing the same work in a stressful work, and this is not a mechanical work. You need, your brain should be very active each and every minute and every moment. You have to make decisions, you have to change your decision. That is, every minute is important, every second is important, and your concentration has to be there at the highest level. Then only you work as a neurosurgeon. So when you come back home and all, this will be there for your head for some time. So you need to de-stress. How to do that? You just to do something unrelated to the medical profession. You have to do something that is relaxing to your brain. I like painting, so I started doing painting, especially in COVID era. The stress was high, so my painting my painting work was also, the volume was also high. So I managing that to de-stress myself. I do painting, I do some sculpturing. It is not very fantastic or anything, but that is one way de-stress me very, very much.
Thank you, sir. I immensely thank you for sharing your valuable opinions about the pandemic situation, and also for sharing some of your unforgettable memories with me. Thank you once again, sir.
It was a nice time for me too, because I got an opportunity to tell you all these things. This was there in my mind, and your questions were very nice, and I enjoyed it very much. Thank you very much. Thank you very much.
Thank you once again, sir. With that, we wind up the show here. This is Maheshwar Thampi for ACJ TV, signing off from Kerala.